So many of them were coming into me consuming like next to nothing, like 1,200 calories and training 3 hours a day. And I'm like, we're not going to cut your calories. Like,
No.
your metabolism has slammed the brakes on because it's in like survival mode, not thrive mode.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Podcast. Our next guest, I've been kind of quietly following and stalking for a while. We were introduced, I was introduced to REDS a number of years ago. We had Tina Muir on to chat about it. And I feel like REDS, Relative Energy Deficiency in Sport, energy, low energy availability, we've been starting to have that conversation far more in just everyday conversations with athletes and Facebook groups and things like that. So Rebecca, when I was stalking her, we got into a chat in the DMs about, well, what about pregnancy and lactation and kind of all this stuff, and she had all sorts of answers. I'm like, why don't we just chat about it here on the podcast? So Rebecca McConville, welcome to the show. Why don't you tell us a little bit about who you are and how you got involved in paying attention to REDs?
Yeah. Well, like most of us, we have a keen interest when we've had a lived experience with it. So as a college athlete, was trying to do everything I could to have that competitive edge and did see some benefit from it, but took it a little too far. So I have an understanding of how it starts with good intentions, but sometimes we miss the mark and how there's lots of varying symptoms that if people aren't discussing it, they treat it in silos rather than looking at the person holistically, which has really led me to how I treat, how I talk about REDs, how I teach REDs as well. Um, uh, I didn't end up with a direct path as like many. I started out in a clinical role, which actually was really helpful because it helped me understand chronic disease and health initiatives and how corporate America works. So I do get it that a lot of times we have to start with things that are diagnosable, and a lot of the symptoms with REDs are not. So from there, that led me into private practice. And I'll never forget when one of the owners said, "Well, we could see you being somebody who specializes in athletes with eating disorders," because at the time, REDs actually the term did not exist. It was female
Right.
athletes. And I just laughed at her and I was like, well, I do have to pay my bills. Well, the joke was on me because ever since then, that has been the area that I have specialized in. And I just absolutely love it. Like, for example, I've got big wishes for a client that's going to attempt her first 100 miler that 2 years ago thought she would never be able to run because
Wow.
her body had been so broken down from years of malnutrition and stress fractures. And so, if you treat that body well, it's so resilient and it'll
Mm.
amaze you what you can do with the little bit and a lot of nourishment and rest and recovery. So, because this was just something that fills up my soul 6 years ago, I decided to what started with the blog, kept going and going and going. And they always joke, they're like, you should write a book. I was like, well, I can't write a book. Well, then as I began, I was like, maybe I should get this out here in a
Yeah.
way that's relatable and connects. And so it's kind of an airplane read. It was called Finding Your Sweet Spot, How to Avoid Reds. Short and sweet, but hopefully hits home with analogies and reframes that people can understand along with the science. At that point, nobody knew what REDS is. So it's amazing. Social media has its bad,
Right.
but it also has a lot of good in the fact
Yeah.
that we can bring awareness. And so now people are starting to understand what that is. We're starting to look at subpopulations like moms, perimenopause,
Yeah.
males, athletes as well. And so now it's the fine tuning. I still think we have work to do in the fact that we have a lot of awareness, but we're
Mhm.
not seeing it translated into action. And so hopefully podcasts like this that give tangible tidbits of how people can get started on it is helpful.
Yeah, no, that's fantastic. You mentioned kind of navigating this as a college athlete. Like, tell us a little bit about that, what sport you did in kind of what you were experiencing at the time, and then now looking back with the expert eyes.
Yeah, so my sport was actually basketball. So that's also why I include that we need to screen everybody. We can't just look at the groups that we think are high risk.
Yeah.
And it was a multitude of different ways symptoms popped up. And it's funny when you're younger, you don't really remember everything in detail. But I knew that I started exploring what I was eating. I can't even remember what exactly had changed, but I was like, oh, my energy levels are better. Oh, you know what? I need to be the top of the pack when we our coach had a love of running, and so we actually did 2 mile, which is kind of funny for basketball players.
It is funny.
So, yeah, then I started adding additional running in,
Mm,
and, I remember we had, a blood donation, and I couldn't donate because I was anemic, so they encouraged me to
mm,
go to my medical provider. Well, I went to my medical provider and started on a iron supplementation, but then I'd had lots of irritable bowel syndrome, so there's so many things that are, like, red flags,
yep.
and I couldn't tolerate the iron supplement. I started having, like, really erratic periods, but I thought it was the stress because I also had fractured a rib that didn't heal like it was supposed to. And so as I started as a clinician, I was like, "Oh, man, I had so many red
Mhm.
flags." But since there wasn't collaboration or they didn't even know to put those together, that I had taken it too far. I
Right.
was underfueling, I was overtraining and not recovering, and that was the body's way of trying to talk to me, and eventually worked my way out of it, but it probably took me 6 to 9 months, and unfortunately, I kinda isolated from my teammates because I was so tired. As soon as I got home from practice, I wanted to
Right.
go take a nap where normally we would hang out, and one of them said, they're like, "You're just not yourself anymore." And I was like,
Mm,
right, but I don't know what it is because 'cause
right.
you're in the weeds, you don't know, you can't see
No.
anything. So, that's what really led me to be compassionate that many times nobody goes into this thinking, "Hey, I wanna feel terrible, get injured,
Right.
and not hang out with my teammates." So
Yeah. No, I feel like and I wanted to start with that piece just because I feel like it's the storytelling piece that really can start to get people's attention because it's not, I don't think it's ever this huge obvious thing. I mean, I'm thinking about being in the running space, like Lauren Fleshman and Kara Goucher when their books came out and being very open with, hey, I know this is going on around me. I'm not necessarily going to go there. And then all of a sudden, before they realize it, they're restricting calories, they're overtraining, like that kind of thing. But it's those stories that I feel like, at least when I was, we're talking, in the 90s, you didn't openly talk about eating disorders. You didn't openly talk about, fueling, we had the Snackwell packs, 100-calorie packs and, it's very much a get smaller, do your Taibo and your step aerobics and you're constantly moving and constantly don't eat that, or especially in college. I mean, how do you feel like, kind of looking back as well, society has kind of set us up to start to have these conversations and share these stories where we didn't before?
right. Oh, absolutely, and that goes back to where social media, really can have some good, and then now we're talking about it more on professional platforms like at conferences and, using different education. That's also what led me to start, my REDS certification program, so REDS informed providers, so they know what to look for, they know how to treat, and they know who to collaborate with as well, and we start with connection with emotion.
Hmm.
And so when we hear a story and we're like, "Oh, that sounds like a lot what I went through," then you're intrigued and you're drawn into that. And so that was me sitting across from my athletes and I'm like, "Ooh, I did the same thing. Like, I need to get this out there. I need people
Right.
to understand like this doesn't have to be or no, you don't need to lose weight." So many of them were coming into me consuming like next to nothing, like 1,200 calories and training 3 hours a day. And I'm like, we're not going to cut your calories. Like,
No.
your metabolism has slammed the brakes on because it's in like survival mode, not thrive mode.
Yeah. With some of the basic things, so we've got a lot of, cross section of providers listening and everyday women listening. And there might be a few dudes out there listen too. Um, what are some of the most common symptoms or things that you hear in people's stories that light up your brain to say, this combination of things that I'm hearing, we need to have a conversation?
Mhm. So when I teach this, I talk about how we have like the emergency responders, which are the early on signals that most people look over because it's really easy to go, okay, I'm tired. Like it could be sleep, it could be stress. There's a multitude of different things. But when we get to what I call like the third responders, those are the ones that most time people think about, like
Mm,
their loss of menstrual cycle for more than 3 months, a stress fracture, a compromised bone density, or a significant change to their body. Well, at that point, that's because things have really been shut down to conserve energy. And so you're feeling it, and you also have like medical complications. But
mhm.
as we go back and the body is trying to give you early on signals, it can be that your digestive tract starts to slow down. So you're not going to the bathroom as regularly.
Yep.
That's because it's trying to get every last morsel of energy and it can't keep up with efficient digestion. It could be that all of a sudden you're having restless sleep and waking up. Well, might be between 2 and 3 in the morning, your blood sugar's dropping and your brain's like, uh-oh, we don't have enough energy where we used to. And so it's trying to wake you up to go get something to eat. You might start to notice, like, if you're paying attention to heart rate data, you may not realize that you've had some symptoms of under recovery going on as
Mm,
your heart rate stresses and your variability goes down and your heart rate goes up when you're waking. Most of the time, people only look at their resting heart rate and, like, well, that makes sense. I'm in the end of my training block. I should be improving fitness, but they miss the other
mm.
signals around them that their body's starting to scream at them. So there's lots of really subtle ones, but it takes somebody to already be looking for that, what we call like interoceptive awareness, which is how that body is speaking to us.
Right.
We don't have that language. I would love for that to be started in schools instead of having them track calories and
Yeah.
look at your step count. Learn how your body's talking to you.
Yeah, no, my daughter is 12, and anytime I hear any of this stuff, my brain immediately goes to her, and she does sports and paying attention to, kids that are, doing multiple sports and playing multiple teams and travel and all this kind of stuff and really kind of starting to go in that direction. And they're starting to be aware of their bodies and what they eat and all this kind of stuff. And I'm like, is this where this all starts? Um, yeah, and then what they get in health class. Like it does.
Oh, I'm like, I've even reached, if you can believe this, I've even reached out to some of these companies and be like, I'm willing to donate some time to go over a curriculum. Oh,
Yeah,
this is already set in stone. No, thank you. I'm like,
I
you're
know.
professionals. And there's several of us that have done that. So if you're
Yeah.
out there, we are willing to help because we want to shape the generation coming up that they don't go through what we went
We
through.
did. Yeah. No, it's interesting not to jump ahead on life stages, but like some of the things that you were mentioning, as far as sleep disruption and kind of that, like because of where I live generally in the postpartum perimenopausal space, I'm like, how do you even know the difference? And I think that's why it's so important to talk about these early signs, is it's really easy when you're in these other phases of life to just blame it on something else.
Hmm.
You're like, oh, well, I'm perimenopausal. Of course, I'm gonna, have insomnia. I have a newborn. Of course, I'm not gonna sleep. I'm gonna be up for all these different things. Whereas if you're younger, maybe those are a little bit more obvious to see. Um, how have you kind of seen these initial sort of early signs, like as you're starting to understand them better? How are you seeing that kind of be applied into these other more complex populations?
So when I first work with somebody, I like how you brought up the narrative. I just have them start sharing what's going on, and then I start a timeline assessment. So I have them just share what's going on in life, what's going on in their training, what's going on
Mhm.
with their body, medical, etc. And then I go back from there and I look and I overlap them, and then I go, "Ooh, did you notice, like, if we connect these dots,
Mm,
that as you had your kiddo and you went back to work and you were cleared to do activity, that all of a sudden XYZ started happening, but also you didn't increase your nutrition, or you didn't add in extra hydration because you got busy at work." And so it helps them start to see how that unfolded,
yeah,
where if they didn't kind of lump sum journal and put them on a page, they wouldn't probably put all that together as well.
yeah.
And I think that's where we also need to take a moment. I really try every morning, no matter how hectic my day is, to at least just sit. I do my coffee, I do my devotional, and then I kind of just check in with how I'm feeling
Mhm.
before I get started in the day. And I think a lot like yesterday, I was like, "Oh man, I'm kind of feeling tired. I wonder if I'm starting to catch a bug." And so a
Mhm.
little extra TLC, I took a power nap. And then by the end of the day, I was like, okay, I'm starting to feel a little bit like myself. I'm glad I pulled the reins back that day.
Mm.
But I can remember when I started back to work with my daughter. I mean, it was how many times was I up that night
Oh,
and then
yeah.
in the
You didn't have
ground?
a choice. Yeah.
Yeah, I was fantasizing about dark hotel rooms, just sleeping all day. So,
That's
yeah.
okay. You're not the only one. How old's your daughter now?
Well, now she's 16, so
Okay, so you can give me hints on how that's there's probably gonna be some sleepless late nights in your future there.
yes, yes. Funny how that shifts.
One of the things I was thinking of when you were talking about that is, wearables
Mhm.
and, HRV and things like that, and I got my Whoop back in 2019 basically to help me confirm whether or not I was crazy, because I was like, "I feel bad. Am I actually bad?" Like, and and this was pre-pandemic, so I have all that data through. So I got really good, solid algorithm here now, but, no, it's one of those things that I use because I was like, "I'm tired. Am I really tired? Did I drink enough?" Like, I wasn't sure of what I was feeling, and you're just like, "Should I
Mhm.
feel like this all the time?" And I don't know, maybe that's just mom in the clutches of, I think my kids at the time were, I don't know, like 4 and 6 or something like that. I feel like you don't know what end is up. Is
Right.
I would assume it's probably the same with an athlete that's, trying to keep their scholarship and trying to stay on a team and trying to keep up with their academics. Like, do you really know how you're feeling? Um, do you have recommendations as far as, and hopefully this is a nuanced question, but as far as people using wearables to help kind of navigate and get some answers here to kind of fill in the gaps.
Yeah, I love this question. It's actually something I'm preparing for to teach to my mastermind group, so
Oh,
you're
great.
catching me on top of
All
the
right. I love it.
Yeah. So I think it's a great way, as long as they take the data with a grain of salt. So when you've kind of compensated and you get used to a new norm of energy, and you're like, okay, am I tired, or is this just how I've been feeling? Like, or is this more than usual? What the apps and what the wearables are doing is they are trying to look for trends in data,
Right.
and so they can catch it acutely if maybe you are getting ready to get sick. It can kind of look at the heart rate, your body temperature, especially as some of them start to look at our skin temperature, or again, your heart rate variability as you try to exert yourself. The other thing we have to look at is if it's chronic stress, right? That can start to compensate and there won't be a lot of trends. So that's
Mm.
actually helpful that you have data from years that
Yep.
you can start to look at. And so they use correlation where you can look at certain variables. So for those of you that have that, the more data you can dump into your wearables, the better. And just try to be consistent with what you give it,
Hmm.
because it'll catch that trend. And then if you're like, well, I'll use an example. I had a athlete who had been coming back from a bone stress injury. She's a mom of young ones. She's also a medical provider, so she's very busy.
Yep.
And she had reached out and she's like, I'm concerned because my recovery scores are going up, but I don't really feel bad. But I have my last big training run this Saturday before my marathon. What should I do? And I said, well, just keep watching those trends and let's see how your body feels. And then she emails me. She's like, "Oh, I came down with what the kids had, and
Yep.
now I do not feel good."
Yep.
And so she pivoted at that run, but it was only like 2 trainings that she had to make adjustments to, and then
Hmm.
made a great race.
Yep.
So sometimes it can be a good warning signal. And then if you pull back and look at sleep, stress, nourishment, how you've been managing your recovery, that will sometimes tell you how to interpret that data.
Yeah. No, I find it's also interesting too. You kind of have to be cognizant of who's also using the data and what they're using it for, because I find some clients get overly in the weeds on it and it's not helpful. It actually
Right.
drives things a little worse. But to your point again, that's why I appreciate that I have this considerable amount of data across some considerable points in life that I can be able to go back and say, okay, this is generally how we operate, which is good. Do you recommend, younger athletes when they're trying to figure things out as something to add? I mean, I tend to, if I have somebody already using it, I'll try and use whatever data that they have. But is there ever a situation where you're like, you know what, we need more. This might be something that's good for you.
Yes, as long as they take it to a professional to help them interpret what to do with
Yeah.
it.
Yep.
Is sometimes either maybe TikTok told them or even the wearables
Yes.
themselves will give them
Hmm.
scores, and then they don't know what to do with it, and
Right.
they panic or they ignore it. So I do feel like as a place, just like continuous glucose monitors really got the
Oh, yes.
year ago, and I do think
Yes.
they have a place, but when you just give it to an individual that doesn't have that medical background and they're extrapolating what we've done with diabetes, that is not the same thing, and so that's where I feel like technology can cause more harm than good if it's not in the right hands with somebody who knows what to do with it.
I'm so glad you said that, because I feel like there's so many things that grab popularity that people do it because they think more information is better, and sometimes they're not understanding what that information really should be used for and where it's not a great use of information. Like, I don't know if this is out of your wheelhouse, and feel free to pass if it is. The word cortisol. Sorry, you didn't know that was coming.
Oh, here we go. No, just kidding.
Just things like that, I mean,
Well, and cortisol, insulin, things like that, that you
yeah,
kinda understand cortisol is a good thing, but no, we
right,
don't want it flooding all the time. That's not what its intended job is. Same thing, glucose spikes. So,
right,
considering your population, now they really are hitting continuous glucose monitors for women that are going through the transition, and then they throw out things like glucose spike, and I'm like, we all will have glucose
right,
spikes. Now, if you have diabetes, you struggle to make the insulin to bring the glucose down and that needs a consideration. But
right,
if you don't, let your body do its thing. You don't need to try to make all these alterations or panic or add more stress, which increases your cortisol, which increases your blood
right, right,
sugar.
right, right,
Yeah,
exactly, exactly.
vicious cycle.
No, I mean, I think that the general take home on that is like there's so many things that the average person doesn't understand about how our bodies function. And then, we're trying to take things into our own hands and may not necessarily realize the implications of our decisions. I mean, when you think back on, you know, people that you've worked with, what where do people start to go awry as far as making choices that aren't necessarily conducive to good health and what their body needs, especially if they're in sport?
Oh, I mean, I think a lot of it goes back to our medical model so centered
Mhm.
around weight and again
Yep.
using things like BMI
Yep.
and without getting a whole lot of genetic detail. Have they always been at this weight?
Right.
And so instead of it centered around performance and health outcomes, they're almost trying to use that data to contribute or to hit a certain weight target. And that was again what none of those were ever actually intended
Mm.
for. And so that's why I always challenge, like, what are we actually putting under our health and wellness umbrella? And if your pursuit of weight loss has you fasting all the time, not sleeping well, having digestive issues, is that really health?
Right. Right. Well, and you throw body image to it as well. And you've got people trying to hit that number on the scale, and then when they're there, maybe they like how it looks, and then now all of a sudden you're committed to it. Um, at what point, you know, is it? And I think there's a lot of kind of it's multifaceted in that you're having to navigate kind of people's self-image and emotions and all sorts of stuff. Like when you have somebody, let's say you hear these early stories and you haven't gotten to the point where we've got cycle changes yet. What's a great place to start that conversation? Because I know if you come in and be like, well, you're doing this and you're at risk for this, like sometimes that doesn't go so well.
Right. Scare
What
tactic.
Right, exactly. Like, what's a nice indirect way to start that conversation, um, knowing that that person probably has no idea what's going on.
Oh, that's probably one of the toughest parts is when you as a clinician, I can kind of see the writing on the wall that this is
Right.
not getting in a good place, but
Yeah.
they might, like you said, they might be feeling good because they're getting outside validation, or
Right.
you brought up cortisol. Sometimes too, there is a little bit of performance bump when somebody is running on what I call pseudo energy, which is
Mm,
cortisol. And so then it's really hard for them to buy in that they're going to have any performance decline. So
right.
when I first work with somebody, I kind of throw some random curveballs and I'm like, tell me about yourself. What do you like to do? Who do
Mhm.
you like to connect with? What things do you value? And so many times that's where they probably had some changes, like because of their healthy eating, now they don't want to go out with their friends, or maybe they struggle to go out to Friday family night where they would have done
Mhm.
pizza. Or I grew up with that because both my parents work, so on Friday nights, my mom was like, "I'm not cooking," and so
Oh,
she'd go
yeah.
pizza home.
Oh,
And
yeah.
so yeah, I was like, "Yay, Friday night pizza night!" But I think it ends up changing some of their lifestyle to fit
Mm,
whatever they're doing.
mhm.
Or I may say like, "Hey, right now, there are no negative consequences, but can I share with you some of my concerns?" And so I plant a seed, but it's up to them to cultivate it and decide when
Mhm.
they're ready to make some change.
Yeah, no, it really, and it may take a couple reps, I've found, to just start to plant a couple of seeds, and hopefully they start to pull that together. Um, Tell me a little about your experience with so many girls getting on birth control sooner. That vital sign of not having a period, um, it isn't necessarily as reliable. And sometimes, if women are not getting their period, they'll be put on birth control to kind of force that and whatnot. What's been your experience kind of working with, whether it's younger girls, athletes, all the way up through the spectrum? Because what I'm running into now, women with IUDs going into perimenopause, they don't know that they're in it because we don't have that data or that information.
Right. Yeah, it's tricky because at one point they said 50% of female athletes were on some sort of
Right.
control.
Yeah.
And so I always try to, with permission, ask them, like, are you on birth control for any reason other than the intended purpose? So was it
Mm,
they had heavy cramps in debilitating periods? Okay. Or was it acne or some other hormonal reason? And
right.
then if they were on it for the purpose of amenorrhea, I may share, like, hey, here's some updated education. Would you like for me to reach out to your physician? Because now we know it's contraindicated. So when you consume it orally, it actually suppresses insulin growth factor, which is detriment to your bone health. The
Mm,
transdermal estrogen patch does not. So I always want to clarify that because people get confused, like, well, why would this estrogen method be different than
yep.
the oral?
Because
And
was it kidney processing? Is that what it is?
through
Or
the liver,
through the liver processing?
yeah,
Yep.
yep. And then depending on what form of birth control, so some of the IUDs may not be hormonal, so we have to ask those questions
Right.
and then look for and lean on some of the other symptoms to see if they might be in an underfueled state. But I have had many women, ironically, flip-flop, that have been told they were perimenopausal, but they were in a red state. And so
Oh,
when we got them in a better fueled state, I have several that actually their periods restarted.
no way.
So I encourage women, if you're in that age group and you're starting to have menstrual irregularities, make sure you've been assessed, that you haven't been in a low energy available state. There
Yeah.
haven't been significant stressors that could have disrupted hormones before
Yeah.
going like, okay, I must just be postmenopausal.
That's a really interesting one because again, the women that are kind of going into that sort of, and I'm at that vintage now. Again, we came from the era of, you know, underfueling, overexercising, be smaller. I've seen a lot of that come back with, people being concerned about perimenopause and bone health, and they're trying to do all the things exercise wise. If I see another weighted vest, I'm gonna put a fork in their mouth. Um, I digress. Anyway, I mean, I can definitely see that, and people just accepting, like, hey, no, yep, okay, my period's slowing down. It must be that. Um, and I think also too the growth of women participating in a lot of exercise and
Mhm.
expecting to do that, expecting to do, ultras or, marathons or just stuff that I don't think our moms, that was necessarily an expectation at that age and stage in life. Like it really is, with this activity shift, we almost have to kind of relearn that feeling. It's almost like we have to learn it all over because we didn't learn it right the first time.
Yeah, and they get it twofold because then there's almost so much scare tactics around when you're going through the transition, like this is what's going to happen to your body, and you have to fear for your heart health. And while there's a little ounce of truth, there is a ton of BS because
Yes.
Krishana Shufelt, she's a cardiologist that actually studies functional hypothalamic amenorrhea, which is the loss of menstrual cycle for more than 3 months. She's actually exploring if the reason that women develop heart disease so rapidly after they've gone through menopause was because they actually had amenorrhea before they went through menopause, but nobody ever looked at their heart health.
Wow.
So then if those
That's
women
interesting.
continue to get pressure around watch what you eat, exercise more. I just had this conversation earlier this week with somebody who is an Ironman athlete, female, and she had some labs off and they told her, "Well, you need to eat healthier and exercise more." And she trains about 18 hours a week. I'm like,
That just
"Nope."
is so tone deaf. I don't like it's not even funny because I can't tell you how many times I hear things like that.
Mhm.
It's like, "Oh, just watch what you eat and exercise." An Ironman triathlete, yeah, I'm sure she doesn't watch what she eats at all. I'm sure she doesn't exercise. Like, come on. This is
It
not rocket
needs to be a
science.
full-time job, not a part-time job,
Right,
apparently.
exactly. Oh my God. I mean,
Yeah,
like, where do you even begin with that? Like,
and
I
that's
I
where direct education to our athletes and patients and individuals we work with, and then I'll be like, "If you would like for me to, I can reach out to that medical provider just to explain what I'm seeing from my perspective," and then being able to walk them through the science as to how that happens. Because
right.
cholesterol can be elevated due to genetics, but it also can
Mhm.
be elevated due to malnutrition, but most medical models are not looking at the malnutrition piece of it.
Right. Why would they think that? No,
Mm,
it's so interesting. A lot of the Facebook groups that I'm in where women happen to be talking about, kind of running and sport and um there's I can't tell you how many times that somebody will mention that they had some sort of stress fracture or something. And what's really interesting is that there are a lot of people piping up and saying, "Oh, you need to go talk to a dietitian." And
yeah,
which is fantastic, and I'm really excited about that, but inevitably 9 times out of 10, you get a dismissal back, like, "Oh, no, no, my food's fine." And I get the same thing, postpartum women talking about, "Oh, no, no, my food's fine, I'm getting enough sleep, da, da, da." Like, they automatically assume that because they're probably doing what they did before, or, they're like, "No, no, no, I don't need that, that's fine." I'm like, "No, no, no, you do." Um, or at least go figure out whether what you think is happening is actually happening. I find that because I deal with constipation stuff all the time. Like anytime I have people fiber tracking, everybody always assumes that they have it right, and they don't. They're all like 12 to 15 grams. They're not even remotely close. I'm like,
yeah.
just write it down, and you can't unsee that. But there's a really strong hesitancy to be like, okay, what I'm doing is not okay. Where do you think that kind of comes from, and how can we work past that?
Well, and I don't it's a great question. I've always wondered why some people are hesitant. It's like, would you be hesitant to go to a PT to have an assessment of functional movement? Like, I mean, to me, that's kind of a very similar comparison, right?
Yeah.
And the other piece is, I don't even know if I got to share this with you, but back during COVID, I actually I was so heartbroken when they decided not to launch it. But I was a red specialist for Nike on the project called Olympia.
Yes, you did tell me that.
And it was
Yeah.
preconception all the way through 18 months postpartum. And here I am thinking, all right, I'm the Reds expert. But as I got into this and learned from others on the panel, I was like, wow, we have a ton of work to do in this area, especially in America. When we had individuals that were from, the UK, women go in 6 months, or excuse me, 6 weeks, and they're getting pelvic floor exams.
Mhm.
They're talking to them about their self-care and how they're managing, and can they bring in family members to help so they can rest. It's completely different how they approach mothers. And so That's where I learned just the demands on the body during pregnancy,
Mhm.
the demands if you're breastfeeding as you go back into activity,
Yep.
high risk of REDS development and bone stress injuries because you're still healing from that,
Mhm.
trying to be a new mom and maybe juggling other kids, as well, and then getting back into activity. So I had to do a deep dive for months into research to learn more about it. So if I'm a REDS expert and I had to do
Right.
more, then we know there's got to be some big holes that are out there.
Yeah. Well, again, I mean, people are like, why are we just talking about this now? And I keep finding myself going back to the history. It's really only recently that general society has been okay with watching a pregnant woman run, watching a pregnant woman in a half marathon, in a marathon, doing ultra running. Like that's pretty new. And same thing with postpartum women. Like we're just seeing it like I guess this last Olympics, having pregnant athletes compete, having women come back early postpartum, like we're just seeing more examples of it. I think it was probably happening before, but not to this kind of public level. And so when you don't have that publicity, you're not going to gather that data.
Right.
And that's where I'm like, this has always probably been the case, but now it's more kind of normalized in a lot of places that we're again back to these expectations, expecting women and women are expecting themselves to be able to perform in these different scenarios. So then those potential possibilities come up. But again, like to your point, like does the average woman know how many calories it takes to breastfeed and how long have women been breastfeeding?
Right.
I don't know that I could even tell you. Like,
And then add going back to your boot camps and deciding to
right,
marathon train them, like, we don't have data. We're getting it because now
right.
it's getting attention, but,
Yeah.
yeah, I mean, just even the minerals 'cause it's gonna prioritize
Right.
the baby, and so how do you know and I recently heard this on a podcast, I loved it, and it's like, before we approach nutrition from disease prevention, for the first time ever, we're starting to approach nutrition for optimal health. And so our
Yeah.
recommendations are shifting now to be a little bit more proactive. So maybe they're thinking of like a clinical hospital dietitian that was taught to try to teach them to prevent diseases. So,
Right.
I've shifted how I approach as a result of that.
Yeah, no, that's for sure. But I even think just the conversation around fueling, like I did my first marathon, I think in '04, and maybe I chewed on a bar and like I don't remember it being a particularly good one either. Um, and now like, oh my God, you go to the feed and there's like 7 million options. And do you want caffeinated? Do you want this? Do you want that? Like, I don't even know where to begin. And so I think even just, but I'm noticing women my vintage, like I'm working with a marathoner right now. And she's done several in the past. And I'm like, well, how often are you eating? She's like, oh, I something every hour. And she's going to be a 6+ hour person. I'm like, you got a front load, girl. You're going to be dead by the end.
Mhm.
And she's like, I didn't know that. I'm like, okay, well, we just having those conversations because back when we used to do these things, the same rules don't fall forward. You don't need to chew on the nasty bar. You have the gels early and often. And why am I telling you this?
Yeah, you don't have to feel terrible. You can be tired and recover like the next day. That's what a lot of them are like, "Oh, wow, I would have to plop on the couch and I would be worthless the rest of the day, but now I can be
Yeah.
productive for an hour." And that's what I experienced too. I would get done and then when my daughter, I'd ran some marathons before she was born and then afterwards and I'm like, "I can't do this and chase a 2-year-old around. I've got to find a
No.
way." And so prioritize sleep, prioritize nutrition. I was like, "Oh, I can take a quick nap when I get home and I'm good to go the next
Yes.
day." Yeah.
Yeah. No, I think it was, oh my gosh. I think I finally came back to life again when my youngest was 3 and I'm like, okay, we can be vertical now. We can and I remember, trying to, run 6 miles in the DC heat and humidity, which I think is probably similar to where you are in
Yeah.
middle America. Maybe not so aggressive. Um, but trying to do it fasted and I didn't bring water or electrolytes or anything. And I do remember calling my husband and being like, I need you to come get me. I feel like trash. And then I'd be down the rest of the day.
Mhm.
And I mean, I still now I'll if I'm going longer than 45 minutes, I'll pop a gel in. I'm like, I'm not too proud. I just don't want to feel like trash later on in the day.
Yeah.
It's
You
just
don't have to suffer.
no, but I didn't know. Like, I thought that was just for extra people, and little did I know. And so I am not ashamed anymore. Like even if I'm going out for a 40-minute run, I bring my water bottle with my electrolytes and my ice, and I'm just happy, you know.
Well, I think what's the book? Is it Up to Speed where they talk about the
Oh,
changes? And I'm like,
Christine's book, yeah.
yeah, I was like, it wasn't that long ago, or Catherine Schweitzer would share, like, they literally thought women's uteruses were gonna fall out if they ran, and the first
Yes.
sports bra was invented off a jock strap, so
Yes.
we've come far, but we still have a ways to go if, like, that was only
Yeah.
30 years ago, 20 years ago.
I love so Christine was on the podcast a couple years ago. We also had Daniel Friedman who wrote I think it was Get Physical, which is very similar but talking about like the fitness space. And then Maggie Mertens is actually coming on right after you that she did Better, Stronger, Faster.
Mhm.
And so all of those, it just you I think every woman at some point should read them so that we're making sure that we're doing things differently with our younger kids, not just our daughters, but our sons as well. But like we have to look back and see where we kind of missed the boat on some things, but also where we have so much more information and we just need to use it better. But and you know, the thing that I am thinking about for, you know, the pregnancy postpartum population, yes, I think it's an easy thing to do to screen back and see if somebody had had a prior history of eating disorder. I feel like that's almost a gimme, but don't automatically assume that that has to be there in a way that they knew about for them to have issues going forward.
Right.
Like how much of kind of what you see is somebody who may not have had a recognized eating disorder earlier in life, and this is just stuff that's coming up later in life and they had no idea.
Yeah. Oh, you bring up a topic that I always approach with the utmost sensitivity, but I think it needs to be addressed is when women are having, not just women, it could also be their
Yeah.
partners, fertility related issues.
Yes.
And that I think a
Yep.
lot of times they probably don't realize that it's because they're in a low energy available state. They go
Yep.
through all the heartbreak with trying to conceive or fertility treatment.
Hmm.
And so, I always tell them, I like, I don't treat diagnosis, I treat people.
Yep.
So I'm not here to try to slap something on you, but I'm going to share some of my concerns for what could probably be a barrier in your health, not only
Mhm.
physically, but mentally, because food creates our feelings.
Yeah.
So a lot of times people don't realize that some of the things that they're cognitively experiencing or even just emotion could be related to the fact that they are underfueled or carbohydrates get demonized. But
Right.
man, I love them because I can tell the difference in my mood. I can tell the difference in my training, my sleep, etc. And now we have a link between somebody could have adequate energy, but if they have inadequate carbohydrates, we see it show up in their thyroid health. We see it show up
Mm.
in their bone health as well. So I just think it's something to always be cognizant of the pressures that we feel in society. And then how does that messaging change when we have an adolescent, when we have
Mhm.
somebody who is dating for the first time, when
Mhm.
they're pregnant, when they're postmenopausal, the world of ageism. I love that term now because I'm in that boat too. Like you're supposed to never age or anything.
Mhm. Yeah, no, I think we're in the same boat. Like all these expectations I didn't know we were supposed to meet, but
Yeah.
so for you, like again, half of our the people listening right now are kind of working in the female athlete, pregnancy, postpartum, perimenopause space. From a bunch of different perspectives. Obviously, we have a lot of physios here. What are some things that we can do as providers to be better advocates, better just better at kind of identifying people that might need help? And where's the next best place that we should kind of send that client, or who should we make connections with in our community, or how do we find somebody to make connections in our community so that we can provide resources for clients that might have reds?
Love that question because I firmly believe physios and PTs are really kind of the gatekeepers because a lot of times it shows up in the body,
Yeah.
right? Whether it's injuries or like we talked about functional movement, even things like that from stress. Always got my lovely neck issues from sitting at a computer, right? And so being able to ask them some open-ended questions and see how they respond. So one of my favorite is like, hey, how have you adapted your nutrition over this journey? So whether it's
Mhm.
pregnancy, whether it's they're transitioning through perimenopause, an injury, if somebody has done their due diligence, they'll give you a reason why. If they
Mhm.
haven't, or maybe they got misinformation, they got it from social media, or a friend
Yeah.
told them in a group, then you could be like, hey, this is a trusted expert. They may say you're doing everything, but wouldn't that be great just to have that validation so you
Yeah.
know as well? Selfish plug, I do have on my website those that have gone through my REDS curriculum, which was 10 hours, and they do ongoing education. But it's anywhere from I have physical therapists that have taken that, mental health specialists, I even have a couple medical providers, and then dietitians as well.
Mhm.
Or you can reach out to individuals like myself. We can find out who's in that area and get you somebody who's knowledgeable in female health and REDs or eating disorders.
Yeah. We shouldn't necessarily assume that every dietitian is prepared to work with somebody with REDS. Is that accurate?
Yes, I had some unlearning to do even coming out of school, even though I had REDs. I used to work in a weight management clinic.
Oh,
I know, don't hold it against me. I unlearned though, but I'll tell you how this happened, and it was kind of beautiful. Was that they were getting ready to start having bariatric surgery, and I said, okay, I think we need to have the mental health piece of it.
hmm,
And the psychiatrist that was at the hospital said, all right, here is this eating disorder clinic. Why don't you reach out to them? They came and did a presentation, and I got a punch in the gut. And I
oh,
was like, oh, this is not sitting right with me. I need to change the way I practice.
yeah,
They actually reached out and asked if I would ever go into their private practice, but at that time, I had actually started my PhD, but I felt a calling, and a year later, I reached back out to them, and I started in supervision, and it took years of realizing things that had been kinda shoved down my throat and that I learned
yeah,
were inaccurate and weren't aligned with best practices and values. And so I understand for those that are out there coming out of school, we're taught to like focus on the weight, we're taught to focus on BMI, but that's not the way to optimal health.
yeah. No, it's interesting. I feel like a lot of us that have navigated things that we kind of work in, you have that choice to either when you see that what's actually going on is in opposition to what you were taught, or there's an absence of information, you have this conscious choice of, do I just take it for face value, or do I look for what's probably going to be the harder path, but the better answer? And that's where I really do see a lot of parallels in kind of our spaces where there's better answers out there. We need to do better because we're learning more and so on.
Yeah.
Um, yeah, for sure.
It's unfortunately it's not sexy to say, hey, eat often, eat balance. When I need to find some terms to make it more enticing. Like,
Right? Oh my
nope,
goodness.
I mean, you can have your protein Pop Tarts, but guess what? We can also do it through chicken breast, salmon, like milk.
Okay, so sidebar here. Oh, what was I was watching the Today Show like 2 days ago, and they're like, there is a was I think it was because Starbucks started their protein drink.
Oh, yeah.
Okay, I think there
Protein
was.
balsam.
Oh my God, it's like everywhere. Again, I don't enjoy this timeline that we're in right now, for a lot of reasons, and one of them being like, I think it was there's a Instagram account. I think it's called Big Time Adulting, and she's like, have the number of grams of protein as stars in the sky, and I'm like, yeah, that's kind of what everybody. It feels like everybody's trying to tell us to do, but they forget about the fiber.
Fiber, carb, fat, and they forget that I mean, I have a couple right now that we've got some kidney related issues because they're consuming double the protein that they need.
Yes,
And so, yeah, your body has to work to break that down. And if it's got too much of it, just like anything else, it's going to struggle. So,
yes.
yeah.
No, all these women are constipated, and then no, I'm not even kidding. Like.
I believe
And then they're all stressed out and their pelvic floors are a high tone, which makes the constipation worse. And then they all decide to go on GLP-1s, and then their constipation gets worse. It's just this whole thing. So that could be a whole separate podcast, I'm
yeah.
sure.
Well, and I always end with it like there is a reason that the diet industry remains $1 billion.
Oh God. Yeah, again, like it feels like retargeting. I don't know if you're Gen X or after.
I
I'm Gen
can't
X.
remember what category I fit in. I'm 1980.
Okay, yeah, no, I'm 4 years older than you. So, but like, we'll bring you in just for fun. I'm like, can we just leave us alone? Like, don't tell me what to do anymore. Like, let me eat in peace. First, you tell me don't eat, and then you tell me to eat. Like,
Oh,
I just want to enjoy my lunch.
I know. Just leave the Pop Tarts alone. Like, if somebody wants to eat a Pop Tart, we don't need a protein
Right?
fight. Yeah.
Well, that's the thing so this is why I have a secret obsession with ultra running. I will never become one because I don't have that physical capacity. But I am obsessed with the fact that all they do is talk about food. They
It's
talk about have a Pop Tart. It's great carbs. Have some graham crackers. Have pickle. The pickle juice is a little awkward to me, but like they talk about just eating and it's no big deal. And I'm like,
mm,
that's a healthy, happy place that I can get on board with.
yeah. Well, and I won't get on too many side tangents, but when people will talk about like all foods fitting in, and I share the story behind why Coke is used on like triathlon courses and ultras, is cola syrup was used as an anti-nausea
Yes.
remedy and it's calmed stomach. So you've got that, you've got
Yep.
fluid, you've got carb, you've got sodium, you've
It's
got
perfect.
caffeine. So now Coke looks a lot different than somebody just drinking a soda.
Right. And gummies and all those good things. But again, you have a reason why you're doing that
Yeah,
stuff. Don't just go eat Coke and gummies
right.
because we said so. Please have a 100 miler in coordination with that. Oh my goodness. Okay. So at the end of every episode, we ask a couple of questions. What's a book that you're reading or podcast that you're listening to right now?
Oh, I'm reading The Nudge. So it's about how they use like subtle marketing
Mm,
which is kind of scary actually now when you think about it. Um, and then podcasts. I'm so bad about like I jump around between
me
like
too.
500 different ones. Um, I'm trying to think of the one I just listened to. Is this terrible? Oh, it was Sigma Nutrition where they were talking, and they have a good science-based one, but I
Oh,
listened to
nice.
everything from mental health, business to obviously sports nutrition.
Yeah, you kind of have to be at all the different spaces to understand. And I'm sure with marketing, you have to understand too, because you have to understand what's being told to people,
Mhm.
and how that is potentially influencing choices and all that stuff. Yeah, it's exciting and interesting, except for if you're in the middle of that timeline, you're in the middle of that sociological experience, and it's disturbing.
Exactly.
For you, let's get a little personal. What's your favorite activity since becoming a mom with a 16-year-old?
Oh, that's a great question. So, my daughter also plays basketball.
Oh,
So, it's been kind of fun. We went through this change. I used to coach her, then she didn't want me coaching, which
that's
I
fair.
completely understand. But now she actually likes for me to train her. So, it's been really fun
Aw.
to like pick up and like we go out and we still do basketball together.
Yeah,
The unfortunate but fortunate piece for her is she's now 4 inches taller than me. So playing one-on-one is a little bit more of a challenge, but ladies, it's a great way to kinda keep I have less lower back issues and hip issues playing because I'm moving laterally and going up and
yep.
down, so it's actually been pretty good for my health, and the other thing too is we're big horse people, so on
Mhm.
Saturday we go out. I'm sandwich generation, so I help out. My mother had a major stroke not too long ago,
Oh,
so I try to help out, and then we go ride our horses together, and there's something magical about just the talking as we're relaxing and trail riding, so it'd be
yeah.
those 2 big things, yeah.
That's awesome, and there's great pelvic movement when you're riding a horse.
Yeah, we ride bareback for that reason. Mhm.
Oh, wow.
That's my yoga, so I stay
That's
connected to my
impressive.
horse, yep, and she does
That's
the same.
impressive. Like, back when I was in, PT school, I had an internship site where, hippotherapy, where you rode horses for was part of physical therapy, and I was never around horses, but that was so cool. They used it on it was a neurorehabilitation hospital, so, people that had strokes and spinal cord injuries and things like that, so it was super, super cool.
Amazing.
Yeah. Who's someone in your space that we should know about? Who's somebody you're fangirling over right now?
Oh, I have a lot. First of all, I love being a supervisor because all that my supervisees are just rock stars. So, um, Leslie Schilling's probably one of my favorites because she does a really good job of talking about diet culture, but she also brings in faith in body
Mm.
image, and that's a
Hmm.
tricky one. Val Schoenberg is a rock star in the menopause community. She's actually been an expert in that way forever. And then got to shout out my fellow PT. So Nathan Carlson's big with bone
Hmm.
stress injuries.
Yep.
And then Chris Johnson does a really good job of just
Yes.
talking about like holistically when you're working with individuals. I joke
Yeah.
that those two are my brothers from different mothers. I've known them forever. So
I love Chris. He was on our season 1, and he's just like he's just good people, and just I love he'll throw some stuff out, and I just wanna sit and kinda meditate on that a little
I
bit. I'm like,
know.
"You are so smart." We're
He'll
gonna
just
pull him over to the dark side in pelvic floor too, but
yeah, send me these texts and I'll be like, "That's so eerie, Chris. Like, are you in my head? Like, how did you know to send that text?" Like,
yeah. No, no, no. He's fantastic. I've never met Nate, but I've listened to, the podcast. But yeah, that I think, being in the sports space, it's really fun. You get to meet a lot of really cool, really smart people. And I just love kind of bathing in that. So that's awesome. All right. And then last question, what does it mean to you to be an active mom?
ooh. Well, one, I do think it's great to model it. So it's interesting. As my daughter's evolved, she would joke she hated being active, even though she played basketball. And so something clicked over the summer, and
Oh,
she really started taking it serious, like lifting and running, and then was like, "Wow, my energy levels feel better." And she goes, "I actually sleep better when I work out after school." So it's funny how her mom's a sports dietitian. She needed to experience for herself. And I'm like, yeah,
yep.
that's exactly why I start out my morning like that. If you notice, I come back in a better mood.
Yep.
I get a lot of my clarity with thought. So she's seen that for me, but never could understand why. But now that she's doing it for herself,
Yep.
she gets why that's an important part of it. And then on Sundays before church, my husband and I don't run that day because usually I do a long run on Saturday. He and I go for a walk. So it's really
Hmm.
great because it's kind of our way to catch up
Yeah.
what's going on in life. We talk about what's going on for the week. So
Yeah.
that is my activity as a spouse, being able to stay connected and using that.
Yeah.
We have the Katy Trails in our backyard, which goes all the way from
Okay.
PNC to St. Louis, and it's beautiful.
Oh, that's amazing. No, anytime anybody has trails locally, and we have a lot here in Arlington, you're just fortunate to have that. No, I love hearing you say that because my son's almost 15 and then my daughter's 12, and I'm waiting for them to kind of find that thing or that love or that self drive. And they have I'm waiting and I'm trying to give them space to do that. And so I love that you're like, "It comes, I promise you." But again, like I never want to be that person to be like, "You have to do this." The only rule that we have is you have to have some sort of physical activity every quarter. I don't care what it is. I will take you there. You just need to not be on a couch. But to help them kind of, because I think that's how you keep it sustainable. I started running, I think, sixth, seventh grade. And after that, my parents started running to keep up with following me in cross country. My brother runs now with his 3 kids. Like, it was that decision that kind of fed all this, but it has to come from in. So I love that that worked out for you and you giving me hope.
Yep, like I said, 16, and she wanted to borrow the treadmill from my mom. And I was like, "Oh, great. We're gonna have this treadmill and she'll never use it." And then, I mean, she took off,
Oh,
she puts her show on, she's got her workouts,
okay.
and now that she can see the impact too on the court,
Yep.
she's bought in.
I
Yep,
love that. Yeah, you can't make them drink, but you can lead them to the water.
yep.
I love that. I love that. Awesome. All right, if you want to hear more from Becca, you can find her over on Instagram, Rebecca ED Dietitian. Thank you so much for coming
Oh
on
my
and answering a random DM from somebody you had no idea who was.
no, I love it.
I'm so excited that to have more conversations and more information about this. And again, if we can have more people recognizing this and having, and just starting these conversations, hopefully we can get resources to people faster and sooner and help more. So thank you so much for all that you do. And thanks so much for joining me.
Oh, thank you for this platform.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.